No
chance.
pressure. It's all good. It's all good.
Hey, okay, I'm here with holistic health practitioner and activist Curtis Duncan. Hey, Curtis, what's going on?
I'm good. I'm good. Thank you so much for having me on your show. It's a pleasure. It's good seeing you.
I
It's been
know,
too long.
I know. Finally, Curtis and I are friends. We met at the
CDC
CDC
rally.
rally or protest in
Yes.
Atlanta 2 years ago,
Yes.
and I already knew who you were because my cousin shared a lot of your stuff.
Okay.
So, and then I was like, oh, it's the Curtis, and blah, blah, blah. And then I think you invited me on a show, and it was a talk show, and it was like, I think it was my first talk show appearance. I got that because of you. So thank you.
Yeah. You were on live TV here in Atlanta.
Yeah. Yeah. So that was pretty cool. And then we just stayed in touch. And Curtis is like woke, especially, I said activist, but I guess I need to be more specific and say health freedom activist. And if you guys don't know what that is, health freedom activists really are fighting or very vocal in providing people information about your ability to heal yourself and not be dependent on the pharmaceutical industry. Yeah,
Absolutely.
yeah. Because is that a good way of putting it? I think.
Yeah.
Yeah,
Absolutely. Yeah. I
yeah.
mean,
Because
yeah.
we become dependent, and I think the most frustrating thing too with a lot of people is people are waiting for cures to diseases. They're waiting for somebody to tell them what to do and how to deal with their health, but really the power to heal is yours. You know.
Absolutely. Absolutely.
And this is one of the main paradigm shifts I would like to see happen in our society. People talk about what do you call it, like health insurance and universal health care. I have more of a radical view on that because, I think really we just need the healthcare system for like broken bones and gunshot wounds.
Absolutely.
And other than that, we can
Absolutely.
do away with all these other diseases. So tell me your take on that. You ramble now.
Yeah. So I totally agree with you. And in that the medical system is something that is primarily it's designed to produce profit and it's designed to produce customers. So there's never going to be any cures for any of these different diseases. The medical system actually invents disease. So, for example, a lot of these mental diseases, i.e., ADHD, bipolar, which are oftentimes the results of the vaccines which they give the kids. A lot of these mental diseases actually don't even exist. There is no diagnostic tool to actually say, hey, well, you actually have ADHD, or you just could be a kid that has a lot of energy, but they diagnose you with ADHD so they can then get you on Ritalin, which actually shrinks your brain, makes you suicidal and homicidal.
Let's elaborate it because I think we're just jumping the gun a little bit. We're kind of advanced. We need to take it back to like health freedom
Okay.
101. So
Gotcha.
just to like elaborate. I mean, I can too if you want to, but like how does the that how okay how are these diseases made up? Like with could you talk about the DSM and like science and how it's like psychology and how do you know what I'm talking about? Like
Yeah.
okay.
Absolutely. Yeah. So, in the sense, what I mean by the diseases are invented, if you will. An example of this was that before Pfizer, who released the antidepressants, I believe it was Pfizer, one of those other pharmaceutical companies. Before depression was actually considered to be a quote unquote disease, they actually invented the antidepressant before they invented depression. And this was documented on the website, I think Democracy Now, which one of the researchers, I don't know the exact name of the book, but he documented how before before Big Pharma invented the actual disease depression, they actually had invented antidepressant. And then once they came along and said, hey, are you depressed, or whatever, those little kind of corny, gimmicky, ads that you see on TV. Before
With
they
with
actually
the
had the
egg jumping down the street. You know that commercial?
exactly. Exactly.
He's like, "Ooh."
Yeah. so
Yeah.
before they had, the so-called depression, they had antidepressant. So once they came along with so-called depression, then they were actually to generate billions upon billions of dollars off of antidepressant sales. So, I mean, it's a medical term. It's something known as disease mongering, just like fear mongering.
Yeah.
Essentially, you create a disease, that you want to scare people about, like, oh, man, I have restless leg syndrome, or I have this, I have that, and then, but all the while, you kind of create that hysteria or that propaganda, if you will, in order to sell your particular drug, which the drug is not going to help you. I mean, most antidepressants are known actually to cause depression.
Yeah.
So that's why, a lot of people who take these antidepressants, they actually become depressed. They become suicidal. They become homicidal. They engage in all different types of, mental disorders.
Very true. But I would like to add to that by saying there is an element of truth in the fact that some people do get depressed because in life, people,
Absolutely.
They experience, they get sick, or they experience like someone they love kills themselves, or someone they love dies, or they lose a job. So depression is real. That's not what we're saying. But as far as like, what am I trying to say? Like let me back it up a little bit. Let me explain the difference between science and pseudoscience. So science, it's supposed to be objective. You're supposed to have a test that there's no feelings, there's no interpretation that can be put into the diagnosis of something. There, like for instance, if I have high blood pressure, there's a test that I can get to show that I have high blood pressure. Whereas with a lot of these psychological disorders, there's no like objective test. It's all subjective. So when these people write this DSM book, they basically just go in a room and they vote on it, right?
Exactly.
They go in a room and they vote on it about like how they feel about it, what they think. So even if you go to one psychologist or one psychiatrist, you can get a different interpretation of what you're going to be diagnosed for. Like one psychologist can be like, oh, you're bipolar, oh, you're narcissistic, oh, you're schizophrenic, but it's all based on like it's subjective, right? Absolutely. And I'm not saying that psychology doesn't exist. I think it's real, but you also have to remember when you go to these people, you want to find somebody that you can work with that's going to have your best interest in mind, and what am I trying to say? Just not feed you a bunch of bull, because a lot of God, I mean, I'm not trying to dog psychologists because I know people that have gotten really good help from psychotherapy, but at the same time, you have to have your wits about you too, and realize that it's a two-person street when you're going to these people, that you also have to be in charge of figuring out what's going on with yourself and not just like lay down and just let them diagnose you and let them let them rule you and tell you what's wrong with you. You're supposed to work it out between you guys. It's supposed to be a relationship kind of deal.
Yeah, and oftentimes they and I totally agree with your assessment on that. Oftentimes they come from the band, like for example, they say, oh well, if you're depressed, then it's a serotonin, it's related to neurotransmitters.
They can't test it.
Yeah, when as you mentioned, it's like, okay, well, maybe I'm depressed because my mom just died, or maybe because I just lost my job that I had for 20 years, or maybe I'm depressed because I just got divorced.
Yeah, or somebody was cheating on me, or something like that. Exactly.
That's not a serotonin. That's just you being sad. I mean, and possibly getting into a rut, if you will, as a result of some difficult experience you might have had, or even times. A lot of people because I've struggled with depression a lot. Yeah. A lot of times it's related to childhood trauma. Yeah. And see, again, the medical industry, they don't, trauma and, they don't deal with that. They don't want to, so so if it's a serotonin, then okay, how can we increase serotonin? Okay, we can use an SSRI drug to increase serotonin. But the only problem is that, oh, well, if it's not serotonin, a deficiency, which it is not for 90% of people, then okay, you increasing serotonin could actually kill them. It can make them just become totally whacked out and want to whack themselves, whack their family members, and whack their classmates. And that's what ends up happening with a lot of our kids, who are traumatized or vaccine injured, which I'm sure we'll deal with later. They actually get on these SSRI drugs and end up doing more harm to themselves and to others. as a result of basically the pharmaceutical intervention, which was wholly unnecessary in the first place.
Yes, and on top of that too, like, I just want to reiterate too, we're not saying that serotonin isn't real and chemical imbalances aren't real. They are real, but there's no way to test that. You can't be like, there's no test that you can take and just be like, oh, well, your levels are this, so that means you're this. That's how science is supposed to be. Exactly. Whereas they just have a checklist of questions that they ask you, and then they're just like, oh, okay, here's a prescription. And it throws everything out of balance. And then when you're on those SSRI drugs, you can't get off of them. You can't get off of them. You have to wean yourself off. If you just stop taking them, then you can get seizures, or you can have psychotic breaks, or mental breakdowns. Do you know Gwen Olson?
No. I'm not familiar.
She was one of the first pharmaceutical whistleblowers that I knew of. Okay. And she worked for the pharmaceutical industry, and she basically said her niece, who was, perfectly mentally stable, got into a car accident. Then got painkillers for her knees that were hurting in the car accident. Then she got addicted to those, and then those made her psychotic. So they gave her antipsychotics, and the antipsychotics made her more psychotic, and she killed herself by setting herself on fire. Like, that's how psychotic she became.
Yeah, yes. The number one cause of mental so-called illness in this country are these SSRI drugs and antipsychotics. That's the number one cause of mental illness. It's not, so for people, again, there are plenty of people who have mental problems, who have anxiety. I have anxiety, who have quote unquote ADHD. I know I have, oftentimes it's hard for me to focus. I'm glad I never got any of those, Ritalin or some of those other stimulants. Yeah. Because, they definitely would have made me worse. Caused other negative side effects. But again, I understand that there are many people out here who have genuine mental health problems. But the problem is that, again, when you go to a psychiatrist or a lot of these psychologists, they're incentivized to just write prescriptions, so they're licensed drug dealers. So, they'll be with you 20 minutes, as you mentioned, take a checklist, check, okay, take this drug and get out of my office, on to the next one. Yeah. So they're not really designed, okay, well, tell me about your childhood. Tell me about your current life. What current stresses are you having? Tell me about your diet. Because, there are a lot of research that's shown a lot of people who suffer from schizophrenia really have a gluten intolerance.
Yes. I've come across that in my research, too. Where I was also, I think I'm okay now, but I was having some self-assessment thyroid issues. Yeah. And I was reading that even people that have had thyroid, and this is mainstream medicine, okay? People that have had thyroid issues have been misdiagnosed with like bipolar disorder or schizophrenia. Like if your hormones are that out of whack, it can make you like that crazy. I had no idea.
Yeah, absolutely.
So,
but they're not going to, they're not going to evaluate that because there's no money. There's no money in getting to the root cause of the issue. There's only money in managing the symptoms.
It's no money to be like, yeah.
So hey, you have anger problems. Okay, well, I'm gonna give you some, I'm gonna give you Xanax. They're not gonna really evaluate the root cause of whatever issues that you're having. And as you mentioned, the medical system. That's the kind of the basis of the medical system is to kind of just treat the symptoms and not deal with the root cause. And even furthermore, what I in all my years of research, I've exposed that again, it's the medical system itself that oftentimes is the root cause. Because, if I'm in the business of producing customers, and not producing cures, then I want as many people as possible to have ADHD, to have autism, to have anxiety. That's what I want. So, that's why, for example, the SSRI drugs, they cause cancer. They cause impotence. Okay, well, if the SSRI drugs cause impotence, now I can sell you Ritalin. Okay, and then once you become blind from taking Ritalin, then I can sell you anti-blindness drug.
Wait. So Ritalin can make you blind?
Treadmill in a sense.
Ritalin can make you blind? That's one of the side effects?
No. I'm sorry. Viagra. Not. I meant to say Viagra. I'm sorry.
No. I just wanted to make sure. I didn't know either way.
Viagra could cause you to have color blindness.
What?
Yeah, absolutely.
I'm not surprised, but well, I met a guy a few months ago at the gym. And it's funny though, I don't know if this happens to you, Curtis, but when you kind of set that intention about what your beliefs are, what your interests are, people kind of start to come to you. I've noticed and tell me, not even knowing like my thoughts on it. We weren't even talking about like health freedom or anything, but this guy, we just got into a conversation. He's like, yeah, I'm on the Risperdal lawsuit for gynecomastia, which is when men get large breasts, men get titties. Yeah. I was like, oh my God, from Risperdal. Imagine you're a teenager and you're a boy and you're trying to like hit on girls, but you have breasts.
Yes.
That's insane.
Yes, it's feminizing the young boy. I mean, and like I said, they give this drug to boys at the age of 3.
Yeah, well, I'm not surprised because even like I started my teaching career in South Central. And I did a lot of my long-term subbing and special ed. And what they would do in LA, I don't know how it is in Atlanta, but they would put basically the special ed people, like the autistic, the Down syndrome kids, and then some they just said MR, which is probably to me is like severely autistic. And then they put like these other class, but they labeled them as ED, emotionally disturbed. They threw them just all in the same class. And these kids, they were on antipsychotic drugs and Ritalin and Risperdal and all of that. And some of the classrooms I would go into, they would call it a one-on-one. I call it a bodyguard because you say or do something you don't know what it would be to set one of these kids off. They would literally like attack you. Like I was like, oh, like that flower isn't supposed to be purple. And they would just jump on me and like attack me. I had to jump on a boy. And it was terrible, like 7, right? Because he took scissors and he got the case of scissors and he was throwing them around the classroom. So I had to like get a book, shield myself, make my way over to him and sit on top of him until they brought him his medication.
Wow.
Like this is insane. At the time, I wasn't awake to all this. So I'm just like, what is going on here? Why are these kids bugging out? I had another kid that was about 5 years old too, knock all of his teeth out. He had all his teeth were silver, like jaws and brains round. He would just knock his teeth out. Sorry, I don't mean to like, I'm just trying to let people know like how crazy it is. And then I had another kid, we were watching a movie, he gets up, walks out of the classroom and just comes out. He's kind of like in a daze and he just punches this girl in the face. Ooh. She's watching TV and he just like clocks her and just like,
yeah.
I mean, those are just a few that I can think of off the top of my head. Mm-hmm. But, a lot of it now I'm tracing back and being like, and then the kids would be like, oh yeah, he needs to take his medication. Go back and take his medication. He might zone out for a minute, but eventually it snowballs and it turns into something else. It's like a temporary Band-Aid just to zone. It doesn't even fix the problem. It makes them zombie-like, but then it causes other issues. And then I was dating this other guy on SSRI drugs. He said he tried to get off, start having seizures. They put him on seizure medications, and the seizure medications gave him more seizures.
Yep.
Like, it's insane. It's insane.
Yeah. It is insanity. It's medical insanity, and we have a lot of that. From giving people chemical warfare to supposedly cure their cancer, or giving them nuclear weapons, i.e., radiation to cure.
Could you? I know what you're talking about. Just elaborate on that, please.
Yeah. So chemotherapy. Chemotherapy is the standard. We have cancer, which oftentimes is a result of the chemicals that Big Pharma produces, particularly the chemicals that are found in plastics. It's been well known now, and you can you can look this up. There are a class of chemicals known as endocrine disrupting chemicals. They're found in pesticides. They're found in plastics. They're found in food because most of the food that we eat now is genetically modified and contains high amounts of Roundup, which can, basically contains the chemical glyphosate. So all these different chemicals, bisphenol A, atrazine, phthalates, which are found in rubber ducky toys, which kids suck on. All these different chemicals that Big Pharma makes because Bayer manufactures bisphenol A. Atrazine is manufactured by a spinoff of a pharmaceutical company known as Syngenta. They were a spinoff of GlaxoSmithKline. So all these pharmaceutical companies are making all these chemicals which cause cancer. So then, you go to a doctor, oncologist, and hey, doc, they say, oh, well, Curtis, you got prostate cancer. Well, man, what can I do? Well, we need to give you this chemotherapy. Okay, well, it's supposed to help me? Yeah, it's going to help you. Of course, the oncologist doesn't tell you that, he gets a commission or a cut of every dose of chemotherapy that he gets. But essentially, it's and during World War II, all different chemicals, that they use to actually, to gas people, to kill people, to kill, like all this Nazi medicine which they used to kill Jews. It was then transferred because IG Farben was actually, Bayer was a spinoff of IG Farben. They never destroyed all these different Nazi corporations. They kept those around. They might have gotten rid of Hitler, but they kept the Nazi corporations around. Yeah. So the chemical weapons that were developed by IG Farben to be used by Hitler during his war machine were then, they developed a non-wartime use for them. So they became chemotherapy. And the radiation was used again for war, purposes of war. That became the radiation that was used for people for cancer. Just like fluoride. Fluoride was a byproduct of the nuclear weapons program of the United States government. So they were like, hey, we got all this nuclear waste. What can we do with it? Oh, we could put it in our drinking water and say it's going to help, prevent cavities and all this other stuff. So a lot of the things that the medical industry use are actually weapons of war or byproducts of war waste. And we're all consuming these things, and again, this is a definition of insanity because chemical weapons cannot cure you.
Well, they'll kill your cancer, but they'll kill you too. That's exactly. The thing. They will kill the cancer. They're not lying. Going to kill the cancer, but it's going to kill you too.
It's going to kill you, absolutely. So number one, say, oh, this person died of cancer. No, they died from the chemotherapy. They died from the radiation. Well, I've seen it happen with my own eyes. I had an uncle who was perfectly, he had leukemia, perfectly fine. Had lived with leukemia for years. They got him on one of these immunotherapy drugs. He was dead within 3 days. Literally.
3 days?
Go from being healthy.
What was he doing? Was he doing anything before that?
No. He had leukemia, but he wasn't taking any medication. He wasn't. I think the leukemia.
Well, yeah. Oh no. I know what you. Well, my I didn't know this until a few years ago when she lived well into her 80s. But I had an aunt that had uterine cancer.
Yeah.
And they did remove her uterus, but she didn't do any chemo or any radiation, and she lived well up into her 80s.
Yeah.
And
most people have. Yeah.
And I still, God forbid, if I'm in that situation, I'm in a. Hopefully, I won't because I'm in a very preventative mode, but. I had 3 aunts that were RNs, and I remember as a kid listening on conversation talking about their observations when their patients had cancer and they would get the cancer cut out of them. Then a few years later, it would come back.
Absolutely.
But that's because, I saw in the Truth About Cancer that answered my question where they're saying when you cut the cancer, you're not getting the root of it. And then you release the cells and they circulate in the body, and that's how you can get cancer growing in other places. And I was like, oh, that makes a lot of sense. So even my aunt, she didn't do, but on top of that, if you have chemo or radiation on top of that, it makes it even worse. It makes it more. But so my aunt didn't have chemo radiation. Cancer did come back on her ear. She had it, but it didn't kill her. Mm-hmm. And she lived to be old age, And I just, what was that doctor? Do you know the name of that doctor a few years ago that actually was purposely misdiagnosing his patients with cancer so he can get the cut? I think there's been more than one, but I think there was a recent one a couple years ago. I don't remember his name, but he was misdiagnosing his patients, saying you have cancer, but they didn't have cancer, and he was misdiagnosing them so he can give them chemotherapy and radiation because he got a cut off of it.
Yeah, I saw an article about that. If the average chemo, because we live in a medical monopoly, so we're always paying, the the medical system, allopathic medicine has a monopoly on the so-called practice of medicine within this country. So we pay monopoly pricing. So yeah, the average chemotherapy treatment is like around $28,000 to $40,000. If I get a 30% cut of that, off of each dose, then I mean, I'm raking a lot of money. So I mean, that is, actually that was, I mean, the reason why cancer awareness came on the scene was to actually increase the rates of cancer and also misdiagnose them, because for example, breast cancer awareness month was actually a creation of AstraZeneca, and AstraZeneca at the time was heavily, not only were they manufacturing chemicals which cause breast cancer, but they actually were heavily invested in mammograms. And one of the things we know about mammograms is that mammograms generate a lot of false negatives, meaning that, so not only do mammograms, they expose you to ionizing radiation, which increases your risk of developing breast cancer, but you get a mammogram and they say, oh, well, you have breast cancer, when in reality you don't have breast cancer. So a lot of people, they do get intentionally misdiagnosed. It's not by actually individual, but it's actually just, it's just a kind of a product of the system, because the mammograms are known to generate a lot of false positives. And as a result of that false positive, millions of women oftentimes are getting on these very dangerous and deadly chemotherapy and radiation treatments, which end up killing them. But again, I mean, that's the whole basis of our medical system, is to create disease. It's not designed to prevent disease, not designed to cure disease. It's designed to create the disease. It's designed to create depression, create ADHD.
You remember? Exactly. So, no. Remember when Angelina Jolie allegedly had a mastectomy to prevent herself from getting breast cancer? I thought that was the stupidest thing ever.
Insane.
But I was posting on my wall about that, and I had a lady who's older than me, and her mom died of breast cancer. She's like, oh, but don't you understand? She had that gene that says I was just like, but wouldn't you want to wait to get cancer? And my friend's pretty smart, right? But she's kind of operating out of the fear that her mom died of breast cancer. She doesn't want that to happen to her.
Yeah.
So they tap into that fear too that people have.
Absolutely.
And the thing about that was, even with the Angelina Jolie situation, so supposedly, because we'll never know, it's not like we're going to see her breasts and see but she said that she had a mastectomy and then she had breast implants. But that increases your risk of breast cancer, because you're cutting off your lymphatic system, and then you're putting in, whether there's silicone, which increases your risk of cancer in that area. I was like, that is the most retarded thing I've ever heard of. It's so retarded.
Insanity.
And because of that,
it's well known that breast implants cause breast cancer, as you mentioned, because you're cutting off the lymphatic system, and then you're putting silicone, and the silicone and the little breast implants oftentimes can pop or leak out, and all those different toxins gets,
Even if it's saline though, because even if it's saline in the thing, the whatever the packets are made of, you're just putting a foreign object in your body that's not supposed to be there.
Exactly.
And then the scar tissue, because I had this nurse explain this to me. I used to drive for Lyft, and I lifted this nurse that worked in a really successful plastic surgery clinic in LA. And I was like, before I was woke to all this, and she was just like, I was like, oh, how is it? It must be a really interesting job. And she's like, girl, when I first worked there, she was like, I was so happy. She was like, I'm going to get my breasts done. I'm going to get my lips done. I'm going to get that. And she was like, I started seeing all the patients that were coming in from complications of the surgeries. And she was like, even these surgeries that were successful, they didn't have complications at the time of the surgery. But she was like, even if you get breast implants, you still have to go through surgery again. If you still have to get them redone. You have to keep the body up. She was like, all the scar tissue that happens, and she was explaining this all to me, and I was like, oh my God. She's like, girl, I don't want anything done now. She's like, I'm just happy to have a job. She's just like, she goes, I'm cool, I'm good. She's like, no plastic surgery for me. Reconstructive surgery, fine, I understand that. I still think that there's a place for plastic surgeons, but as far as breast implants and stuff, it's unhealthy. And I'm not judging people that have gotten breast implants, but just know what you're getting into if you're gonna do that. Know
Yeah.
the complications. They don't tell you those type of complications. Really, you have to look that up for yourself.
Exactly. I mean, it's nothing. Oftentimes, a lot of these, feminists, they want to rail on female genital mutilation in Africa, and but I mean, look, female genital mutilation here in America is $1 billion business, and that's what a lot of this plastic surgery is all about. And
I
yeah, I
didn't
mean,
think about it that way. Yeah.
you have to keep going back. You have to keep going back for more surgery. I mean, so yeah, it's
And then
basically
not to mention that the anesthesia and how that's bad for you, and did you see that? Have you seen that video circulating about the woman who had breast implants, but she had lit up breast implants?
She had what?
You can you can light up. She had these breast implants, but you can light them up. You can put a plug in them, and you can light.
That sounds like some transhumanism.
It's transhumanism.
Some cyberborg.
But I don't know. She had it. I mean, it looked real enough to me, and she was like, "Yeah." I'm like, how many different types of cancer is she gonna get from that?
She's gonna get all types of cancer. Just from the radiation or the lights that are going on in her breasts.
That was insane.
I mean, it's insanity. It's insanity.
Yeah.
Pure insanity.
Yeah, and I noticed you talked about the last interview you did. You talked about Gary Null's Death by Medicine.
Yes.
And I'm typing as you're talking, so I can try and get some of these notes. So I'm not messaging anybody else because I want people to when I put this up, I want people to have some references to at least do some research into what we're talking about. Yeah. But why don't you talk about Gary Null and that situation, because I know you know about that.
Yeah. So essentially, Gary Null, he's a tremendous researcher. He put out a report maybe several years ago talking about how the medical system is actually the number one cause of death in this country. It kills close to about 1 million people per year. And he tallied up all the people who die from, who die taking the drugs as prescribed, the amount of people who die in hospitals, the amount of people who die from hospital errors, hospital-related infections. Because a lot of people, they go in the hospital because, and they may go in for diabetes, what have you, and they develop an infection, and antibiotics, since they're all resistant to these different bacterial infections, you die as a result of obtaining a hospital-borne infection. So he tallied all that up. And I'm not sure if he included cancer deaths, but he may have included that. And what he determined was that it was the medical system which kills close to about 1 million people per year. So in a sense, the allopathic medical system it's not curing anything. It's killing us. It's killing us in droves. And for a lot of people, they think that, their doctor or their surgeon is going to help them. Well, turns out that they're actually, you are dramatically much more likely to die, by going into a hospital than you are to stay at home and just kind of, self-treat. Of course, they like to fearmonger about self-treating. Oh, you shouldn't, if you have cancer, you shouldn't take medical marijuana, you shouldn't take cannabis or CBD oil, you shouldn't do this. Yeah. Okay. Well, if you have these different types of disease, they don't tell you that if you go into the hospital, you're likely to die. You get an infection. The antibiotics don't work. Because they're not giving oil of oregano in these hospitals. They're not giving out garlic extract. No, they're giving out these.
Oh, that's witch medicine, though.
These antibiotics.
That's witch medicine. But it's the other way around. I feel like World War II drugs that's used for warfare, that's what they give you. That's witch medicine. What are you talking about? It's totally inverted. It's inverted.
They're giving you things that were just originally designed to kill people, and now became so-called medical treatments. So, Gary Null, definitely check out, he has a great. He's also done a lot of good information about the whole AIDS.
Oh God, everything. He's brilliant. He's Let me. I wanted to say two things, but I want to finish cap on this. It's called iatrogenesis.
Yes.
When doctors.
Death by doctor.
Yeah, death by medicine, or death by anyway. I just want to go back because there might be people that's watching. They're like, well, my dad's a doctor. My dad's like, they're not horrible people. Well, the way it happens is it's compartmentalized. So the pharmaceutical industries write the curriculums for the doctors. And the doctors basically regurgitate what they're told, and they're kind of trained to ridicule anything that's outside of their systematic thought, their training. So I don't think a lot of doctors, there's some doctors, yeah, there are doctors that are like psychopaths, but I think most doctors, most people, most nurses in that industry, most people want to help people, and they're not doing it because they're mean or they're evil. They're just doing it because they think that's what they're supposed to do, and they're just waiting for, you know, the right person to come along, for that news conference to happen to say that they have cures to all these diseases. But that's never going to happen, because like you've talked, you know, throughout this interview, there's way more money in keeping people sick and dependent and keeping them in fear. They don't want people to have the power and the knowledge to understand how their immune systems work. You know, if I were to go to if God forbid if I had cancer or something, I probably would go through like a naturopath just to kind of determine out what would be the best course of action to deal with the cancer. Because there are many reasons, different ways. There are really different things that cause cancer, and then there are many different natural options to treat that. You know, so I knew somebody that had cancer, had it cut out, somebody else, and then she didn't do chemoradiation, but she went vegan. But she had a shit ton of sugar. So I'm just like, but she didn't know. Yeah, and I didn't know her well enough to be like, but in my mind, I'm thinking, oh, the cancer's going to come back. Yeah. It's going to come back. Because she's, you know, so she's like, oh, yeah, I'm a vegan, blah, blah, blah. And, you know, and she had a lot of soy, too.
Oh, yeah.
Soy and cancer. And I'm just like, because that's what a lot of vegans do. Like, I know a lot of vegans. I used to be a vegetarian like that. I used to be a very unhealthy vegetarian. You know, I'm like, I'm eating French fries and pizza every day. Look at me. Cheese pizza. I'm healthy. Yeah, you know? Yeah. But a lot of vegans do that too. And sugar feeds cancer.
Yes. Yes. I mean, as an ex-vegan, I can tell people that the vegan diet, it's a new age scam. It's essentially, you know, I mean, I know plenty of, I mean, like I said, I was vegan for almost 4 years. You know, there are, you know, and I did it originally for health reasons. That's what I believed. That's what I thought, you know, meat was bad. But it turns out that it's carbohydrates, it's the wheat, it's the sugar, it's the grains that are killing people. And I mean, it's actually been that way for, you know, for the past 10,000 years, because human beings.
And the hormones in the meat, the processed meat, you know, that's what's bad. The processed, the processed meat, the nitrates in the meat, the hormones in the meat.
Yeah, the processed meat and the dairy. So I mean, I totally agree. Dairy's bad. You know, dairy is bad. Processed meat is bad. Most of the meat now we're eating is cloned and genetically modified, and you know, fed on grains and corn and soy. So I mean, if you are going to eat meat, you need to be eating like pastured eggs, grass-fed lamb, grass-fed beef. You know, grass-fed pastured animal products.
How about free-range chicken?
I'm sorry.
Free-range chicken, is that okay?
Yeah, pastured chicken. Yeah, that's fine. I mean, chicken is not really as nutrient dense as something like a grass-fed beef or grass-fed lamb. Okay. It's not as nutrient dense, or even like pastured. You know, some people don't eat it for religious reasons, but pastured pork. But you know, if you are going to eat chicken, it's better to eat like pastured chicken as well too. But yeah, I mean, the vegan diet. I mean, you know, it's a diet of disease. It's a diet of death. It's a high carbohydrate diet. I mean, even if you try to be a healthy vegan and don't eat French fries and pizza and cookies all the time, you know, again, I mean, you still, you still are going to have to rely on a large degree of carbohydrates.
I have a friend, though.
Exposed to a large degree of lectins, which are inflammatory compounds that are found within plants, you know, in order to protect them. They are like plant-based poisons. Because as I tell people, like, you know, people say, oh, well, animals don't want to be eaten. Well, plants don't want to be eaten. So, I mean,
yeah.
Run away, but the plants cannot run away. So what the plants produce,
the plants are like, oh! You trying to forget about the ground. Sorry.
What the plants produce are poisons like gluten and phytoestrogens, which are found in soy, and anti-nutrients, which harm your thyroid. They produce those poisons to stop their predators, to stop the predators from eating them. But, you know, since we've been told that, oh, you know, eat your whole grains and eat your soy and this, that, and the third, then, we're being fed all these different plant-based poisons. We're all getting sick, and we have no clue why. But we think it's because of the meat, it's because of the cholesterol, it's because of saturated fat. When in reality, it's the fructose, it's the gluten, it's the phytoestrogens found in soy, it's all anti-nutrients, it's all the lectins. And there's a really good book called The Plant Paradox by Dr. Gundry, Gundry, The Plant Paradox, which talks about these lectins and some of these other inflammatory compounds which are found in plant-based foods. That's why the so-called plant-based diet is actually not that healthy. It's actually killing people. I know plenty of people I have friends of mine, like longtime vegans who are dropping like flies, who are being, one day they're healthy, next day they're dead. As a result of following this vegetarian diet for a long time. It's really dangerous. And I can speak on this intimately because I was used to be a vegan.
I do have a friend that, because I also wonder if there's some people that can thrive.
Yes.
Because I have a friend that's been a vegan for 20 years, and he's thriving. Wow. 20 years. He just had his 20-year vegan anniversary like last month.
Okay.
So I think it is possible, but most vegans I know, they eat very unhealthy. Plus, it's just out of balance. I don't think we're supposed to eat a crap ton of meat either, because you have to balance it out. It's like everything needs to kind of be in balance. But then you think about the Gerson protocol, which is basically a raw vegan diet for cancer, and mixed with like coffee enemas. But that's what Chris Work did. Chris beat cancer. Mm-hmm. That's what he did. He had stage 4 colon cancer, and he cured himself using the Gerson protocol. But he's not a vegan now or vegetarian now. But I think he needed that. I guess the theory behind that is that it like flushes your body with nutrients, but it like all the fiber and stuff binds to all the stuff and like clears you out. So it's a really good way to detox, but also fill your body with the nutrients that it needs to fight off the cancer.
Yeah.
I was a raw vegan for 2 months.
Wow. Mm-hmm.
I lost so much weight. but my allergies went away, my menstrual cramps went away. I didn't have to take my inhaler. Like, it was good for a way. I think it cleaned me out, but then I couldn't. It was unsustainable for me because I lost too much weight. I'm not trying to get any thinner. I'm already thin.
Exactly.
So you gotta also, I think people need to kind of experiment and figure out what works for them. But as far as like, you gotta be very wary of the stuff that you're eating, and this is what people are just so ignorant of. And I'm not saying, people are stupid, but because I've had to find this stuff out myself through my own experimentation process, through my own experience, through talking to people, through, all this stuff. No, there was no flipping news conference. No doctor ever told me this. I had to figure this out by myself,
Absolutely. And I do think, the vegetarian diet can be therapeutic. I mean, if you've been eating McDonald's and Murder King and, all this other crap.
Did you say Murder King?
I mean, if you've been eating all these different, toxic processed foods.
Toxic health.
Eating some spinach can, it could do wonders for you. Particularly, if you have asthma, because, a lot of people have asthma because of the dairy, So, like for most people, dairy, it's going to be a huge problem for
gluten them. Has also, helped my asthma a lot, cutting that out. Gluten and dairy, too.
Absolutely.
Because gluten's inflammatory, yeah.
Exactly. Those foods are highly inflammatory, and they're highly allergenic. So, if you have, inflammatory health condition like asthma, or Hashimoto's, or any type of autoimmune condition, then you absolutely should not eat any type of dairy. Even if it's like ghee, because the dairy. All
not
dairy,
even ghee. I'm just kidding. I'm saying not even ghee. What is that? I'm just must be.
If you have a really bad
clarified butter.
Some people, they need to cut it all out to see if they have a dairy allergy, because some people they have dairy allergies.
Yeah,
truth be told, like I said, dairy is a new food in the human diet.
Yeah.
I do say that, okay, if you are going to eat dairy, then you should probably just stick with the kind of like the things like ghee or but things are mostly like dairy fats. But for the most part, dairy is still, it's still loaded with hormones because it comes from a pregnant cow.
Yeah,
It's still loaded with
and they
hormones.
keep them in a state of pregnancy, and so they can
Exactly.
produce the
They
milk. I was like,
artificially,
oh, that's awful. I
yeah,
never think about that.
they keep them in a state of
Yeah.
pregnancy, and we're human beings, so we're not, the only type of dairy food we're supposed to be consuming
Breast
is
milk,
within the first 6 years of life. We're supposed to get breast milk. After that,
which
you
is
know,
amazing, by the way.
huh?
Which is amazing, by the way. Breast milk's
Yes,
amazing. It's amazing.
yes,
Yeah.
yes. We're supposed to be not supposed to be pregnant cows. We're not supposed to be eating that.
Yeah.
So whenever you introduce some of these newer, and dairy's only been in the human diet for the past 4,000 years. Human beings have been on this planet for 300,000 years. So it's not really a good food to consume. So for many people, they have really bad dairy allergies, or they are lactose intolerant. So they only need no dairy. And if you have a condition like autoimmune illness, or you have an inflammatory illness, cutting out dairy, because a lot of dairy contains casein, and casein is a very, very powerful inflammatory substance that whenever you consume like cheese or any type of dairy products, it gets released within the body. And also dairy can also cause leaky gut disorder as well too.
That's my
So
issue, the casein, because people are like, oh, you're lactose intolerant. You know, a lot of black people are supposedly lactose
there you go.
intolerant, and I don't. I can break it down or tolerate it, but I have an allergic reaction, and I think for me it's the casein. The casein
Exactly.
just
Yeah.
like messes me up,
Yeah.
like really bad.
Yeah.
Um,
Casein is really, I mean, like I said, it can cause severe leaky gut disorder. It can cause brain disorders, because all the
yeah,
inflammation. Like I said, I mean, when undigested food particles get into your body, they trigger a lot of inflammation. Of course, casomorphins are like heroin. That's why a lot of people, they're just like addicted to dairy, addicted to cheese. So yeah, for most people,
yeah,
it's
yeah,
better for them.
yeah.
I don't recommend any type of dairy foods. If you are going to do it, you do like some ghee, has all the casein removed.
Yeah.
But for the most part, we have no biological need for dairy within the human diet.
There's so many good substitutes now, though, like almond
There are.
stuff. That
There.
that's not even. I rarely miss it. I just haven't found a good substitute for mozzarella for pizza, but for the most part, I don't really miss it.
Yeah.
But getting back to kind of vaccines a little bit,
Yeah.
vaccines seems to be like a trigger for the
Oh,
inflammation, right?
yes.
And then
Yes.
you're eating other inflammatory foods in your diet, then it just like adds to that.
Yes. Absolutely. Yeah. Yeah. The vaccines, they contain aluminum. The adjuvants intentionally ramp up your immune system.
Which creates inflammation.
Yeah, which increases inflammation. So that's why autism is actually considered to be like an inflammatory disease.
Yeah.
So
Well, all
autism,
these
like,
autoimmune diseases, though, right? Because I've been thinking about this lately too, just kind of like putting stuff together. Autism is a result of brain inflammation, right? Then you have
absolutely,
asthma, inflammation of the bronchial tubes, arthritis, inflammation of the joints, Hashimoto's,
absolutely.
inflammation of the thyroid gland, and then other autoimmune disorders. They're all linked to some sort of inflammation. And it has to ramp up the immune system to create titers. That's what the vaccine does, because the antigen is like the virus that they put in, right? It doesn't create enough titers. So they had
Mhm.
to add adjuvants to ramp up the immune systems to make your body create a certain amount of titers to deem you immune, which anyway doesn't even, that's just their way of testing whether you are immune to something or not. Just it basically just shows that you've been exposed to the disease too. It's not a good indicator of whether you are immune to a disease or not, because you can still test positive for these titers after vaccination
Mhm.
and then still get the disease, that you were
Absolutely.
vaccinated for.
Absolutely.
So this is just,
Because your immune system, because I mean, it actually suppresses your immune system. That's what
yeah,
vaccines do. They don't. They overly stimulate it, and then as a result of the overstimulation, the immune system actually becomes suppressed.
yeah.
It doesn't. Because you essentially, whenever you're inducing artificial immunity, then your immune system is not going to be as effective
But
as it would be a natural immunity.
wait, think about this, Curtis, too. I was thinking, you probably thought about it, but I was thinking too, how the whole theory of vaccination is that you're taking vaccines to ramp up your immune system to protect you, right?
Mm-hmm.
But you can do the same thing with fruits and vegetables, right?
Absolutely.
The whole like paradigm has changed where like I always use measles as a good case because that's what everybody freaks out about. It's like measles, depletes your body of vitamin A. So when you hear about these deaths or people going blind from measles, it's in the third world where they don't have adequate nutrition, adequate access to vitamin A because of industry. Their crops have been ravaged. Even if they're eating plants or they're having animals that eat plants and they eat the animals are not getting sufficient amounts of vitamins in their body that the humans eat. Because it's like a cycle. This whole ecosystem, this whole cycle that's been ravaged by the industry, whether it's like industrial companies that have come and messed up the environment, or the medical industry. And I was listening to did you ever? I'm gonna send this to you if you haven't, because this know this already, but it was an interview with John Rappaport and Gary Null.
Okay.
And it's a snippet that I found, and they were talking about how Gary Null was talking about how this guy basically came up to him and told him how they were trying to destroy him, and told him stuff that nobody else could have known, because he's getting too close to like showing the fraud in the medical industry. And John Rappaport had a similar story where this guy came up to him and was talking about how they destroyed, how they were going after Peter Duesberg because he was getting too close to like figuring out the real problem of what was causing AIDS. Yep. And basically he said, this is how we keep the system of control around the world. Not just, in third world countries, but also in the first world. It's a huge system of control by keeping people sick. And he was like, they know, the people at the top know that the real cause of AIDS is like what causes people's immune systems to break down, right? Is the fact that there's no, they're not only, the adequate nutrition that I was talking about, but the fact that their crops have been ravaged for years, and it's generations of malnutrition.
Yes.
So it's like if you're a mom that's malnourished, you have a baby, you're only going to give your baby a certain amount of nutrients in your breast milk, if you even breastfeed. Because I was talking to a guy the other day who's from my friend that's from Africa, and he was saying that his mom's a nurse, and he was like, she's livid that they're selling powdered milk to people in Africa and getting them to tricking them into thinking that their breast milk isn't worthy. And he was saying they've even made it a social status where it's like you're more cool if you have like the powdered breast milk. You're more worthy instead of like. And he's like, and they're falling for it. It's crazy.
Yeah,
and he was.
Nestle has actually
Nestle
like hundreds of kids because they're they're pushing all this infant formula into the third world, into Africa and all these other places, and the water supply is really polluted. Mm-hmm. So because in order to create infant formula, you have to mix with water, whereas breast milk is naturally sterile. So what's ended up happening is that these poor, oftentimes uneducated, illiterate mothers in Africa who don't know what's going on, they unintentionally give their children infant formula, and the children die. But not only that,
and then they say it's AIDS.
Yeah. The infant formula itself actually causes malnourishment because there is no substance that will ever be invented by mankind that will match the levels of nutrition and benefits that are in breast milk.
Breast milk's a living organism.
Exactly. It's physically impossible.
Yeah.
It's physically impossible to create any so-called substitute for that. It's just impossible. So you're already malnourishing. So, just by giving the baby that, it's the immune system, because the immune system cannot develop without breast milk. As I always tell people, the original vaccine was breast milk. And human beings are supposed to be getting breastfed from the age, for about 6 years. Now, they're not going to get breastfed for 6 months. But we're supposed to get, and that's the exact same time that it takes for the immune system to develop. But here, in America, we destroy the immune system with infant formula, with soy formula, and with vaccines. Wonder why we have a generation of kids that are so, sick and are so have so many mental problems. It's because they're not getting adequate the things they need early on in life.
Yes, you're like spot on. And plus, I was also thinking about like how this whole idea that we have to eradicate diseases is poppycock. I'm trying to find other words other than cursing. Maybe that was too much. but the fact is really, I've just been thinking about this, like how to articulate it. It seems like it's the imbalance of the ecosystem.
Mm-hmm.
Because it's like, okay, when you come in contact with germs or diseases, what makes you sick is the fact that they multiply and your immune system can't handle it. When you have certain nutrients and stuff, you create an environment, homeostasis for your body, A, to not get infected, or B, to be able to fight off any organisms and stuff really fast so they don't multiply. But when you're malnourished, they can just ravage you, right?
Absolutely.
But that's the whole thing with like microbial diseases and sanitation, because you found out how to do that in a city, right? By like having sewage, having incineration, having sanitation, then they don't fester. Like back when you heard about the Black Plague in Europe, what were they doing? Horses were crapping in the streets. They didn't have sewage. They were, they would pee in a pot and throw it out the window. They would eat their food and just throw it on the streets, and then rats would come, and the rats would. So you're having all of these organisms kind of in an environment where there's no balance, and you're allowing disease to fester. Why, as if you're in the wild, you already have an ecological balance, right? Because if something dies, then like it seeps back into the soil. You have or vultures come and pick out a certain amount of it. You have insects and bacteria that come and gnaw away at it. There's a system that takes care of that. And that's why you don't need like sewage and sanitation in the wild. But if you're in a city where there's concrete, it doesn't seep back. You're like kind of blocking that system with the concrete. I don't know. It's just kind of like, I've been thinking about this lately because I've been trying to, my deal is like, it's simple, but I'm trying to get this information out to people in a way where they can use their common sense and put this together without having to read studies and all this stuff too. Yeah. Because even in third world countries, there are people that know this. People get vaccinated, their child dies, they know it's the vaccine that's causing them to die. They don't need to read a study. They were killing people in Pakistan a few years ago, healthcare workers, because their kids were becoming damaged by vaccines. They need to read a fucking study. Mm-hmm. You know what I mean? Like this stuff that we've been tricked to, that the medical people in the medical industry and science, they've been deified as these all-knowing creatures when they're not. They're not. No, and people need to get out of that mindset and like kind of understand things in a more simpler form where nobody can trick them and nobody can guilt trip them or make them fearmonger them or bully them into like going something that's against human nature. Mm-hmm. Sorry.
I mean,
rambling.
To your point, there's a book, I think it's Guns, Germs, and Steel, but basically what just to kind of briefly talk about human evolution.
Is that Nancy Banks?
I'm sorry?
Is that Nancy Banks?
No. Dr. Nancy Banks wrote the book AIDS, Opium, and Diamonds, talking about the whole AIDS hoax. Actually, I think it was recently, and Dr. Nancy, it was recently revealed. I saw some news articles that people posted that essentially Dr. Banks, what she was talking about with AIDS, Opium, and Diamonds, which is an excellent book. And she's a great. We actually had her here in Atlanta to speak at one of the Vaxxed showings. We had like a vaccine conference at Life University. So she's an awesome researcher. Dr. Nancy Banks talked about how the South African government, because South Africa, is really big on diamonds and mining. So, they had a lot of people who were getting sick as a result of being in these mines during apartheid South Africa. So instead of actually compensating these diamond miners who were getting sick as a result of being underground and inhaling all this toxic dust and, from the gold and from the diamond mines, they just said, those people have AIDS. Mm-hmm. And I mean, I think it was recently revealed that I think the South African government was actually trying to increase the AIDS rate within the black population. And this kind of, and this also corroborates with the information in the book, Behold the Pale Horse, by William Cooper, which talks about how the U.S. government actually was, they're trying to, the AIDS virus or HIV was essentially a bioweapon, eventually that was invented originally by the U.S. government. It was never released, but they were trying to develop something, to destroy people's immune systems, but they never, released it. But essentially, in South Africa, the apartheid South African government and the American government at one time were like one and the same. They were like, the American government tremendously.
They probably still are, though. They're just more hidden, but yeah.
Yeah, they supported, like, even Reagan was a huge supporter of the apartheid government. So, but yeah, that's a really good book. But also, just to kind of touch on the human evolution aspect, human beings were hunters and gatherers for most of our existence. And we had, of course, as you mentioned, when things died in nature, they died in nature. And we also did not have close proximity to animals. So a lot of these different diseases, like look at chicken pox, smallpox, cowpox, a lot of these different diseases are actually animal-borne diseases. And as a result of agriculture, which we developed 10,000 years ago, we actually got exposed to a lot of these different animal diseases as a result of us being farmers and engaging in husbandry of animals. So we developed all these different diseases. So what the research has shown was that with the age of agriculture, not only did it decrease our overall health because, we start eating more grains and corn and wheat and sugar, but we also increased, we also became civilized, and we became, we were exposed to animal diseases because we were farmers and we were raising cattle. And then we became civilized and we developed cities. So then we all became concentrated within these cities. And as you mentioned, within those cities, oftentimes you had really bad sanitation. And this happened for like decades, and that's why people were dropping like flies, in the Middle Ages, during the Black Plague, etc. But then in the 20th century, people actually developed sewage and sanitation, and that caused a dramatic decrease in infectious diseases. Then here comes these Johnny-come-lately vaccine makers. After the disease has already been decreased through the increased living standards and sanitation, they want to come along and push the vaccines and say, oh, see, it was the vaccines which caused the decrease in disease. No. It was actually an increase in sanitation and increase in sewage. Because before then, people are like, they live around cows. If you know anything, the first vaccine was for cowpox. Yeah. And they actually, think about this, they actually injected people with the pus and the blood of a cow.
Yeah. And I found so much research.
Immunity from the cowpox. They didn't say, well, hey, if people are getting cowpox, then maybe we should have less people working around cows, or less people working around the swine, because that's where you get the swine flu and the chicken flu and the bird flu. Maybe we should have less people working around these animals. But no, they didn't think that way. They just thought, okay, well, we're going to take a diseased cow and we're going to give that person a diseased cow's blood in order to generate immunity from cowpox. And that's why the first vaccines were utter failures. They actually killed more people because, once people got the cowpox vaccine, everybody who came in contact with that person actually caught cowpox as well, too. So that's why, like I said, the whole premise of vaccines.
They're just retarded. Well, you know what, too? What's even crazier is there were actually people even in that era, around that time when this was happening, when Jenner happened, that had common sense that were saying, like, what are you doing? You're retarded. This is crazy. Lots of prominent people, lots of people in science, in medicine, and I'm going through and collecting this research. I found a lot of these people, and they've just, like, erased that and buried that as if they don't exist. Like, they just act like when Jenner had the smallpox vaccine, that, that it was like the second coming of Jesus, and, everything was great, and everybody agreed, and everybody was in agreement, and they just accepted that. And I found so much research and so many commentaries, and there's another guy, Alfred Russel Wallace, who was an evolutionary biologist, who was a hardcore anti-vaxxer, who spoke and wrote a lot about this. Gandhi, I'm going to send you this. I found a copy of PDF of his book, Guide to Health. Yeah. He talks about that.
With Gandhi. Yeah, absolutely.
Yeah, no, but the book, have you read the book? his
Well,
book.
no, I mean, I'm familiar with some of his quotes against vaccines.
I'm gonna send you the PDF to his book. You'll love it because you'll like flip out.
Yeah,
but he I found a copy of his book and he talks all about it in detail, not just that quote. Because I heard about the quote and then I was trying to hunt down the quote and I was like, I need to like a really good reference for this because I know I'm going to get those people who's like, oh, well, that's just a quote. It doesn't mean anything. And I'm just like, okay, well, I need a reference for the quote. So I actually found the book and he talks about it in the book and he basically talks about health and the whole like system and stuff like we're talking about. Like he was murdered. He probably could have lived longer, but he lived to pretty old age, you know? So I think he knew what he was talking about.
Yeah. And I think he probably, I mean, I don't know, I mean, you know, but I mean, he understood that, you know, because like I said, I mean, these vaccines today, you know, I always tell people, you know, vaccines are about population control. They're about eugenics. So during the time, you know, when he was speaking, you know, I mean, I'm sure the British Empire was using these vaccines to kill off, you know, I mean, because I mean, they're already killing off, you know, I mean, I think like, you know, I think during British imperialism, I think like almost like, you know, millions of Indians had died as a result of the British imperial policies.
Yeah.
And I mean, and at the time, you know, the Indians were actually fighting against British imperialism. So it would have been very, you know, I'm sure the British employed these vaccines to kill off the population, just like HPV vaccine is used, you know, to kill off girls in Mexico and Pakistan and Africa. You know, it's all about eugenics these days.
And you know, it's some.
You know, I think people should be really, you know, particularly Black people. You know, I mean, there's a lot of talk about mandatory vaccines, and they're using under the guise of the whole MMR vaccine and MMR outbreaks. But the MMR vaccine, according to the CDC, is known to cause a 240% increased risk of autism in Black boys and 167% increased risk of autism in Blacks. So, you know, these vaccine mandates are really about, you know, a form of population control. It's a form of covert eugenics. And they're doing this in Africa. They're doing this in Haiti. The MMR vaccine, you know, I think my good friend Petey at WADU, he did a really good expose about how MMR was used, I think, during medical trials on Haitians, and it killed off like a bunch of Haitians. It was used in South Central Los Angeles, and it killed off a whole bunch of Black babies in South Central Los Angeles, you know, because they were using these experimental MMR vaccines.
And you know what? And God knows, you know, what's in them because with the did you hear about the Corvelva study that just came out?
No, I didn't hear about that.
So God knows, we only know supposedly what's in the book by what the manufacturer lists. But Corvelva is an Italian group a few months ago just did a study where they're having an independent firm do, figure out what's in the vaccine. So they took a hexavalent 6-antigen vaccine. And I know it's 6. First of all, I was like 6 in one. But they did a study on that. Found there were no antigens in the vaccine. And a bunch of and some unidentifiable proteins that they're just like, what is this? We don't even know what this is. So who knows? Who knows what they're putting?
I know MMR has been found to be contaminated with glyphosate.
Yeah.
Which I was thinking about today is like, there's really no such thing as vaccine contamination. If it's been quote unquote contaminated, that means somebody intentionally put it there.
Yeah, because it's already contaminated.
Yeah, it's already
it's already full of chemicals.
With formaldehyde and abortifetal tissue and aluminum and mercury. But yeah, I mean, because glyphosate is a pesticide. So how the hell is a pesticide getting into a vaccine? That makes
or the HCG hormone.
Yeah, HCG hormone.
And it has been found in like at least 7 different countries. So like it's maybe one time. That's all you get. Maybe one time to find that hormone. But 7 times? 7 times. No. Somebody is potentially like
they consistently find it. I mean, because I think the Catholic Church, they did a study.
Yeah.
They're pushing this whole tetanus vaccine in the Philippines. They found it there.
Yeah.
And as you mentioned, 7 other countries. And then in 2014, they found it in the vaccines that they're pushing in Kenya.
Yep.
So that's not an accident.
Yeah. And for those that you don't know, HCG is a hormone that you produce when you get pregnant. So when you take a pregnancy test, you pee on the stick, that's what the test is detecting. is that hormone. So if you know how vaccines are supposed to work, you inject somebody with something, your body fights it off in order to, create that, immunity. But what happens if whatever you inject your body with, your body's going to fight off. So
Exactly.
if you have something if it's an antigen, it's going to fight against the antigen. If it's a chemical, you come in contact with that chemical, it's going to make you, it's going to fight against that chemical. If you put HCG when you become pregnant, and
you won't be able to become pregnant.
You won't become, if you,
your body will have or whatever. I'm sorry. Go ahead.
Miscarriage. You're right, but I'm saying if you become pregnant, then your body will spontaneously miscarry because your body's trying to fight off because your body's like, oh, HCG, oh, pregnancy, invader, bump, and kills the baby.
Exactly.
So that's intentionally done.
Yes.
It's not an accident.
Yes.
Especially when you have
they don't put glyphosate in, because again, as vaccines, I've always said, and I tell people this, particularly within the back, there will never be a safe vaccine.
Yeah, I'm not about that.
Population control, and vaccines are designed to create disease. Because the vaccines were invented at a time when disease was on the decline.
Yes, exactly.
Before they had MMR was they had like 6,000 MMR deaths in 1920. By the time MMR vaccine came around in 1960s, it was like 500.
Wait. Oh, I'm sorry. I just want to 1920 because the measles vaccine wasn't invented until the 60s. MMR came in later.
The 60s when measles was on a decline.
Yeah.
So before MMR came out, before the measles vaccine came out, MMR had already dropped by almost like 90%. Like the deaths from measles had almost dropped by 90%.
Yeah.
Without the vaccine.
Yeah, it's I don't know. Like I still get people that. Well, one thing I will say, I think more people are open to talking about this now.
Yeah.
Because when I first started this, and when April and my friend, my best friend, we had this podcast, we would get death threats. We would get crazy people. We'd have to disable the comment section or either moderate the comments because we couldn't control the amount of vitriol.
Wow.
And it wasn't even like, we welcome people that try to debate it scientifically, but it wasn't like, die you child killers, like we're going to rape you, we're going to do all this stuff. I mean, just like horrible stuff that we had to be like, holy crap. But now more people are like way more receptive and way more interested in at least having these conversations. But I see we're at the tipping point, and that's why they're trying to censor people. And they cut it out because more people are becoming curious, and more people want to talk about it.
Everything that's been happening lately, I'm kind of, I'm seeing this as a, it's a planned strategy, because it's like, we had, and that's when I first met you. I mean, almost like in 2015, we had, I had got, we had a rally. The Nation of Islam was there. I mean, we had news reports. We had Ben Swan. We had all this momentum. You had all these documentaries come out. You had Bax, you had Trace Amounts, you had Robert Kennedy. You had a groundswell, and people were waking up. You had a massive groundswell, with the vaccine movement, and and it was waking a lot of people up, and I'm sure a lot of people, it was just nonstop, and a lot of people were waking up. A lot of people, were getting the exemptions. They're like, hey, I hear, the MMR and autism and black, so a lot of people are getting exemptions. And then, and again, this is not, I'm not here to, of course, we knew at the time that, they are trying to bring, we knew at the time that they had Healthy 2020. Okay. Mm-hmm. So, Healthy 2020 was right around the corner, in which essentially they were going to push, to have full vaccine compliance. And then people, got excited about Donald Trump. Because, and he was right. I mean, he talked about how, babies will go into the doctor and they'll get the vaccines, multiple vaccines at a time. They develop autism. He's totally right. I mean, a lot of people, because they give kids oftentimes 5 or 6 vaccines at a time. That's way too much. I mean, again, that's the definition of insanity. Yeah. You cannot give kids,
especially Hep B. Come on, huh? Hep B.
Yeah, I mean,
that's great.
Sexually transmitted disease. You cannot do that. for like a disease. For a disease that most people don't even have. And you're just giving it to everybody. You're not even testing a mother and see if she has it.
Yeah.
See if she has the disease, and even if she did have it, 90% of the time she's not going to transfer it to her
And
developing.
and it's not a communicable disease. It's crazy.
It's not a communicable disease.
Yeah.
And it's hepatitis B doesn't even kill. It barely even kills people. It's very treatable. So but you're injecting people almost with 350 milligrams of aluminum on the first day of life. So it's utterly insane. But then you had this you had this groundswell, and then Trump came along, and people, and I feel like people became kind of complacent. It's like once Trump got elected, they feel like, with the Vaccine Safety Commission, and they felt like he was going to do something, which as of yet he has not. And again, I'm not here to get into political debate.
Yeah, but also I just want to say people shouldn't even be, whether he does something or doesn't do anything, people shouldn't rely on one person to
absolutely.
Yeah.
And I feel like that's what tends to happen oftentimes, with these politicians, and again, I don't support no political party. I think left wing, right wing, they're all puppets of Big Pharma. Big Pharma is the number one lobby in this country. They spend more money on political bribery than do the oil companies. So, people want to talk about vaccines and anti-vax, it's like, you have nothing but pro-vaccine propaganda and pro-vaccine puppets that are elected into the highest positions within our government. And it's a pay-to-play type system. Big Pharma donates billions of dollars to these politicians, and they get vaccine exemption laws. I'm sorry, vaccine. I'm sorry. They try to suppress vaccine exemption laws. They try to make vaccines mandatory, and they get vaccine liability. Whereas if you get injured by a vaccine, they're not liable. In a sense, you cannot sue them. And if you try to sue them within the vaccine courts, you actually have the federal government fighting against you.
Yeah.
They're saying you're the liar. You're trying to get money out of us. Your kid wasn't injured by a vaccine, even though he got 4 vaccines at a time. You're making it up. You're just trying to get money out of us. So it's like, even though $4 billion was paid out by the federal government to people, who were found to have valid vaccine injury claims, 83% of the cases that are brought within vaccine court are thrown out. Yeah. So literally, you have a situation where it's like the vaccine,
and then there is only
mandatory, and if you get injured, you can't even sue the people who injured your child.
And you need that money for treatments and stuff. It's not like you're gonna. It's not even like you can enjoy that money that you're gonna get. It's
I know. Look, I have a mother. I know a lady. She's a single mom. Single black mother. Her whole life is ruined. Her son has autism and I think Asperger's. He has everything. That whole spectrum. And her son, black boy. Her life is ruined. She has no life. You know what I'm saying? And it's hard for her to put her child in a school, of course, because of the bias that, black boys experience in school overall. But then, a black boy that has autism, it's just, she has a hard time, getting him in school, and, and he has behavioral problems. Her life, so yes, I think I think that the cost of managing a child that's autistic is almost over the lifetime of that child is almost like $200,000.
Oh, probably more than that. That's being generous.
Way more than that.
You're being generous. I think it's way more.
Yeah, that's a conservative number.
Yeah. So. I just what are we talking about? We're talking about. But you know what? So this whole thing too. I had a friend. We were talking the other day. And he was like, "Oh, they're debating, political exemptions in New York." And I don't know, Curtis. I'm at the point where I'm just like, meh, because I feel like I've done what I can do. As far as I'm doing what I can do, I'm talking about it. They've already made up their mind. You saw what happened with the Senate hearing, where they just had the 18-year-old boy speak, and they didn't have that, decided to get vaccinated against his mom's, wishes. And but they wouldn't let Robert F. Kennedy speak, how they had hundreds of parents show up and they just basically locked them in the basement until the Senate hearing was over and wouldn't let them go up and speak. They made up their mind. You know, the people in power, the puppets, the government, they've already made up their mind about what they're going to do. And
Yes.
everybody at that Senate hearing was pro-vax. They had no opposing information from the other
Yes.
side. They used the 1950s graphs, you know, to show the decline of disease, and they didn't show all the data before that. That's available in different first world countries. I'm just like, it's already fixed. Just like in California, I saw what happened with SB 277.
Yes.
But the thing is, here's a hope, I think. The cat is already out of the bag.
Mm-hmm.
So there are going to be some people that are going to be bullied into it because of fear, because they feel they have to follow the law.
Yes.
And it's sad that those people are going to, you know, have to learn the hard way. But they'll know. And then there are people that are already awoke and they're not going to comply. And they see what's going on, and there are also people that are waking up because they see how hard they're pushing this without any evidence and without, you know, common sense, and those people are going to be turned on. So I don't know, I'm kind of thinking, I was telling my friend that I think it might get to a point where it's going to be physical. There's going to be riots and stuff.
I mean, you know, I don't know. I have a different outlook.
Okay, what do you think? Yeah, I mean, we're just wargaming here.
So just back to my point, I feel like, you know, even like I said, I know we had a respectful disagreement, but I'm just going to say this just to interject. We can, you know, have a friendly debate, but, you know, I feel like everything that's being done right now with the whole suppression of any type of so-called anti-vax information, it was designed to destroy the vaccine movement. It's designed, so essentially it's designed to destroy that, to crush all resistance, in a sense. Mm-hmm. It's designed, and it's also designed to bring about, you know, the end game is to bring about mandatory vaccines. And I feel like, and of course, if you elect somebody on the surface like Trump who, you know, may question or criticize vaccine, then that can help to kind of pacify people. Yeah. And, you know, I mean, in a sense, I mean, you know, to me, he was the Trojan horse because, you know, people thought that he was really going to do something. I always knew that he wasn't because of the whole money controls politics type dynamic. Yeah. Not that I'm totally against Trump. I just know how money controls politics, and big pharma pretty much controls this whole economy. Yeah. You know, they just do. You know, you go against big pharma, they will kill you. They have, I mean, just like they have no problem killing doctors, they have no problem killing presidents or anyone who goes against their rule. Yeah. So, so I always knew, you know, so he was a Trojan horse. So now it's like, okay, we have healthy 2020. We have everything in place. We have Trump in power. You know, Trump's not going to do anything. Congress has been bought and sold. So now we can just bring about mandatory vaccines. You know, of course, you know, if people get injured, they're not going to get any help, you know. But I feel like, you know, but you also have this huge police state, you know, because what I mean, they're doing SWAT raids now. Yeah. You know, so they're bringing SWAT raids now on people who are anti-vaccine, people who don't want to get the vaccine. I mean, they're having like people with guns showing up at their houses. So they're trying to terrorize the population. So, I mean, yes, I mean, you know.
Well, so my point is, it's going to be a fucking war, because
possibly, but here's the thing with terrorism, beloved. You know, violence is very effective. So violence can have there could be two things that happen. Yeah, I mean, there could be possibly a riot. There could be, or there could just be like diversion, like Russiagate, or, you know, I mean, because I mean, like the system we live in is the master of diversion, the master of like, you know, okay, turn this way so you won't look that way. So all this stuff with Russiagate and all this bullshit with Russiagate, like that was designed to like distract people about was, you know, like about the vaccine mandates and everything they're doing, you know, all these things that the corporations are doing behind the scenes, and the 5G and some of the things the Trump administration is doing and all the bombs. I mean, it was designed to distract people, you know, and it was primarily pushed by Democrats. So the so-called resistance. So, I mean, it's like, I feel like oftentimes it's like, you know, even if, I mean, I don't know. I mean, the population has been so dumbed down by the TVs, by the Wi-Fi's, by the cell phones, by the public school system. I mean, by the food. We're being so dumbed down. It's like, even when it's obvious that, hey, your kids are being destroyed by these vaccines, it's like people, you know, I don't know. I mean, you know, it's like via the terrorism and all the SWAT raids and all the stuff that people see on TV. It's like people are just, I mean, you know, they're just gonna.
You think some people are going to roll over?
I mean,
maybe I'm in Texas. I just feel a little overconfident.
I feel you. I mean, look, I mean,
I don't know. Like, I see what you're getting to, because I'm just trying not to be in that. I'm trying to be in that place where I'm realistic and see what's going on, but I also don't let myself get overcome by fear and so like what do you call that when you like not disillusioned,
like
complacent or feel defeated, where I'm just like, oh, they got us, oh, I give up, because you can become like that too. And there are people like, oh, well, the new world order's coming, so I'm just like, well, what the fuck are we fighting for? For what then? Just roll over and die.
Here's another thing. There's a process known as desensitization.
Yeah.
Okay. So it's something just to be aware of. And that's why I kind of because we're dealing with medical terrorists and medical terrorism. These vaccines are about traumatizing, destroying, and terrorizing kids, particularly black kids and brown. It's about terrorism, black and brown kids. So what ends up happening is like, okay, and this is an example. Okay, let's say me and you're dating, and I smack you. You're like, the first time I smack you, you're gonna be shocked. You're gonna be like, man, fuck you, and you're gonna be ready to fight me.
I'm black. I'm gonna slap you back.
Okay, but
sorry.
Let's say you don't do that. Okay, but you're shocked. But then I do, okay, and I stop it. I don't do it. But then a month later, I smack you again. And then okay, you're gonna be, after a while, you're gonna become desensitized to it. Well, man, that's just the way Curtis, he just beats me.
Well.
And I feel like, it's just kind of like, other day I was driving in Atlanta and I saw it was like a huge camera, they have all these police cameras. I'm sure when the first camera came along in a convenience store and on the street, people were like, man, what the hell is it? This is invasion of privacy. This is Big Brother.
Yeah.
But now cameras are everywhere. We become desensitized to it.
Yeah. I see. No.
You don't even notice it.
The boiling pot. The boiling frog in the pot.
You don't have any outrage over it anymore.
The boiling frog in the pot, basically. But
outrage. Just like we're getting 69 vaccines. In my mind, it's like if people in America haven't risen up yet, what's it going to take? What, 89? 79.
Well, I think it depends on the situation. They're debating exemptions, religious exemption in New York. In Arizona, they just voted to expand exemptions so people can get more exemptions. In different places, it's different in different parts of the country. But my thing is, going back to your I guess we got to start wrapping up soon. Going back to the desensitization, I think I said that right.
Yeah.
They're wrapping things up so fast, though, that they're not able to do it as slowly as they'd hope in order to get people. So now I think that's why I'm saying the genie is out of the bottle. Because they're because even if they win with the censorship and stuff, there's still people that are going to get injured. There's still people that know that vaccines can cause injury. They're going to seek people like us out, even though like maybe our videos won't pop up into their feed.
No.
And for some people, unfortunately, it's going to take them having a bad experience to do that. Or maybe somebody will see somebody else, like I did. I saw what happened to my friend and my cousin have a bad experience in order to wake up to that.
Mm-hmm. Yeah.
So I don't know. I think it's somewhere between. You also can't be like, oh, everybody's like awakening. And you can't be like that delusional. But you also have to be like, all right, you can't lose hope and you can't be complacent and you can't just... You have to realize that there's also good things that are going on too, and that we're at the tip. I think I'm just saying we're at the tipping point, so it can go either way. We can be free, or we can.
One thing I will say is that, like, the good news. I'll say the good news is that, like, and I'm very proud of. I'm proud of. I was involved in this, like, particularly within the Black community. I've never seen. Like a lot of the activism that me and you were a part of. It really woke up like a huge segment, of the Black community. Not that the Black community was not ever like kind of awakened to these things, as I but like for example, like there was a video that I was a part of in which Ben Swan, he was like a local CBS reporter.
He's in Atlanta. That's right. Yeah, I know Ben Swan.
Yeah. He did a video talking about the whole CDC whistleblower scandal. And literally like that video like still gets shared. It still gets shared on like on social media platforms that have like 1 million followers, that are directly reaching Black people. So it's like, I mean, I will say, like, a lot of the activism that was done pre all this vaccine tyranny,
yeah,
it's like, I mean, in a sense, you can kind of see it's in response to that. So people so people are kind of aware. They can see, like, okay, yeah, I mean, they're doing all the CDC and all these other people, they're doing this stuff in response to a lot of the Bobby Kennedys and the vaccine rallies and marches and vaxxed and some of these other, different, some of these other people, a lot of the different activism that was out there. So, I mean, so it's quite, because like, yeah, it's like, okay, if, I mean, it's quite evident, okay, well, if you're going to say that MMR doesn't cause autism, well, your own government data showed that it did. So how the hell are you going to be disingenuous and say that, oh, you're going to put out a new bullshit study saying it doesn't cause autism? Well, the government just said it did. So is this new study to cover up? Like, is this new study a cover up for the government's cover up? Because the government, documented, I mean, even though the government covered that study up about how it did cause autism, the government documented its own data, documented how MMR causes autism. So now all of a sudden, oh, well, MMR, according to the new study, it doesn't cause autism. So, like, I mean, in a sense, I feel like a lot of people are awakened to what's really going on, and that, in a sense, they're trying to now take away their health rights. They're trying to take away their freedoms.
Yeah.
And
like I said, more people are more they want to listen more now. Yes, I get more people that want me to talk about this instead of
absolutely.
trying to.
Oh, yeah, I mean,
so
people have been asking me. I mean, that's why I'm really glad to do this interview with you. It's like, a lot of people are like, Curtis, man, hey, I mean, like, when you think about all this stuff that's going on with MMR, and then I'm like, well, man, I mean, this just, I mean, it's healthy 22. They're trying to just bring down the hammer, and they're trying to attack the people that really have, like, like me and you, like, we don't have, like, we're not on Fox News, and like, we don't have, like, access to, like, millions of people. They're trying to come after the so-called anti-vaxxers when it's like, okay, well, if MMR, if MMR vaccine was so effective, then how come there's still outbreaks?
And to just comments, his questions, and the whole thing that happened on the Navy ship, the mumps-like illness and all that stuff. But the thing I just want to say is wrapping this up, but like, they're trying to silence us because they're being so effective. They're spending millions of dollars, maybe even billions of dollars, and we have nothing. We have no money.
We have nothing. We have nothing but a
YouTube channel. So just think of all this stuff. They're baffled that their Jedi mind tricks aren't working anymore. And, I'm just going to keep talking about this until they pull the plug. Or maybe they won't pull the plug, but, I'm not going to be, like, my videos are demonetized and everything, and I'm not, I'm not going to shut up. So.
I know you've been talking about this issue. I mean, well, I've been talking about this issue. I mean, I first started talking about vaccines in 2009. That was my first YouTube video. Talk about the whole swine flu hoax, and I know you've probably been talking about just, so I mean, yeah, me and you are both.
You're about a year or so ahead of me, probably.
Huh?
I think you're about a couple of years ahead of me. Maybe about 2010, 11. That's when I started. Okay. So.
Yeah, I mean, because like, I've always, like I said, it's always been about eugenics. I'm like, this is like, I was always, and I was accused of like harming the Black community by like, telling people not to get the swine flu vaccine, which is, now it's like, like. It's like, it's been proven that the whole swine flu vaccine was more dangerous than the whole swine flu. So,
yeah, totally.
But yeah, no, we're going to continue to talk. I mean, like I said, I mean, we were featured on public TV here in Atlanta. I've been on public radio shows. And more and more people are really kind of waking. I mean, yeah, they're getting the exemptions, because I'm telling people, like, look, just get the exemption. I mean, you get the exemption. Okay, don't do your research and then get the exemption. Because the good news is that if you get the exemption before they bring about the mandates, you'll be okay. But if you don't have no exemption, when them mandates come in, then But then if but you still got to tell people. You still got to talk to people and let them know like what problems the vaccines are causing. Because even if they get they bring in these mandates, you're gonna let people when you really know. When you really, really, really know, I'm not talking about people that are questioning, that are on the fence, but you really, really know how bad these vaccines are, you're not going to let somebody inject you. You're not going to put your child in school. Even if it means you have to rearrange your whole life. Yeah.
And stuff like, it's not it's not worth it. It's not
Yeah,
worth
I mean,
it. It's
I
not
tell people
worth.
like, look, I mean, I mean, hey, I understand, for, particularly like for a lot of, black parents, they single family households and they may not have the means to homeschool, but I'm like, look, I mean, you're dealing with a situation where it's like your child could die. Your child could be like have a permanent, lifelong injury, whereas they won't be able to go to school ever again.
And then you're gonna have to quit your job anyway,
Yeah,
or something. You know what I mean? You're
I mean,
gonna
like
have
I said, I mean,
to,
I
you
mean,
know.
because when you're dealing with a vaccine injury, I mean, you're not just dealing with some little like little fever. No, 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 no. A lot of these kids are like paralyzed.
Yeah,
They can't
paralyzed.
talk.
Also, cancers and Alzheimer's and all this stuff later in life. It's cumulative
Exactly,
too. So
exactly. I
there's
mean,
no way.
and the thing is that I mean, as I tell people, you have no recourse. I mean, you cannot sue.
You
You
cannot
can
sue.
try.
Plus, you don't
You're not
even
making
know.
nothing money.
No, I'm sorry, I didn't
Right.
mean to cut you off. You can't sue, and you don't even know how to cure the people. Because people that I know whose children are autistic, some are successful, some are partially
Yeah.
successful. My
Yeah.
best friend, they've been trying
Yeah. I know.
everything,
Yeah. I
and
know.
not successful. So
Yeah.
there's no like, cure or way to
No.
guarantee that if you're injured that you can turn around. I'm having success for the first time in my life by cutting out dairy and gluten and sugar and all these things and exercising just with my asthma and allergies, and that's been hugely debilitating. I had really bad menstrual cramps so I couldn't function,
Yeah. Wow.
and
Wow.
really horribly bad, depression. So all this stuff has been reversed or partly helped, not totally cured, but just by changing my lifestyle. But who knows, it's different for everybody. But with me, with all, like, as hard as I worked on my health, I'm never getting a vaccine ever again. Ever. I've worked too hard for all for that to be reversed, to get another bunch of chemicals and inflammatory shit shot up into me. I don't have children. So for me, somebody comes to my house trying to vaccinate me, I'm fighting back because to me, it's a matter of life or death. So that's what I was talking about too, where there are some people, when they know how bad it is, it's going to be a riot. It's going to be war because they're going to recognize it as that's assault.
Yeah, it is.
And
I had an experience recently where like I was coerced. That was a long story, but I mean, like, I unwillingly got a tetanus shot, and I was like, I was scared I was going to die. This is about a couple of years ago when I was doing my vaccine activism.
Well, you know what? That actually happened to me. I was actually coerced into a tetanus shot too, but at the time, I didn't know what I knew now. And had I known, I would not have taken that tetanus shot.
Yeah, I mean, exactly. I was coerced. But I realized.
But I think the more you know, that you can't be coerced. And at that time, I didn't, like I said, I know as much as I know now.
Yeah,
I was kind of at that level. I was like, oh, maybe they're not all bad, or maybe maybe this, maybe that. But now I'm like, hell no, never again.
Yeah, exactly. Yeah,
never again.
I was coerced. I mean, the doctor pretty much. And oftentimes I have a problem with setting boundaries and whatever. So
yeah,
and the doctor like threatened to, he was like, oh, if you don't get the vaccine, I'm gonna call, get your doctor on the phone. He was like threatening, he like coerced me.
Yeah. No, that's bullying. That's not even coercion. That's bullying. But yeah, I totally.
Basically, he scared the shit out of me.
Yeah.
Because I had gotten like a little like a foot. I had gotten I had gotten a puncture wound, and I didn't do anything about it. So he just scared the shit out of me.
Yeah, but I'm saying, but knowing what you know now, that when it happened, like with me, I was living across overseas, and I cracked my head open, so I didn't even know the language. And the translator was like, he said, if you don't get the shot, then you come back, you get hurt, we won't help you. I was like, damn it,
Yep.
Got it.
Yeah.
And now I'm just like.
Knowing what I know now, I mean, because for most people, like if you get a puncture, I mean, first of all, the tetanus vaccine, it only works if you get tetanus within the first few days of getting exposed to it. So other than that, it's totally worthless. Second of all, like most people, even if you get a puncture wound, as long as it bleeds out, then you don't have anything to worry about. You just need to. I mean, the biggest thing is just because I had an infection. The biggest thing is that just make sure you treat it. If you get a puncture wound, make sure it bleeds out. Make sure you use hydrogen peroxide or Manuka honey. Yeah. And make sure you put a Band-Aid over it. And if you do get an infection, take some oil of oregano, and that's it.
Yeah, and that's done. So I mean, but like I said, I would never ever be
No, I
coerced into
wouldn't do
getting a
that.
vaccine ever
No.
again because I know enough information to outsmart the doctors and shit now, and that can just curse somebody off if I need to too.
Yeah. Yeah, yeah, exactly. Yeah,
You know what I mean?
yeah, as you mentioned, like, yeah, I'm willing to fight, like, yeah, I mean, because someone wants to assault me, yeah, I'm willing to like fight them, but for the most part, I avoid doctors. I mean, because I
Yeah,
don't,
yeah, 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 for sure, for
they're,
sure.
I mean, as a friend of mine talked about, they're agents of the state. So
Yeah,
I mean, like in a situation where I think a mother brought her child to a doctor, and the doctor discovered that the child was 2 years old and was totally unvaccinated and had a fever. The doctor actually called Child Protective Services on that parent.
and they did
So I mean,
SWAT.
so
Yeah,
I tell people these days, like, look,
yeah, yeah.
if you're trying to do the whole anti-vaccine route, and you need to avoid doctors as much as possible.
You need to avoid doctors and you need to educate yourself as much as possible. Because the thing is, where they get you too is if you're, the more information you have, the more confidence you have.
Absolutely.
And especially when you can outsmart the people like the doctors and the scientists, like there are a lot of things that doctors and scientists know that I don't know. You know what I mean? But they don't know jack shit about vaccines. And if you research more than them and you can reference others, and I get my information from other doctors and scientists, so you have to erase your thinking that this whole medical establishment is under a consensus and everybody agrees with each other. That's not true. Like not even by a little bit. So you need to get good references. You need to understand your immune system. You need to understand the doctors and the scientists that are critical of vaccines and why, and be able to break down to people in simple terms. And then, when you have a doctor that comes at you and make them look stupid, they'll probably kick you out their office, but you got to also remember that they work for you and you don't work for them. Okay? Mm-hmm. So that's another thing. Let them kick it. Go find another doctor. Give another doctor your business, your money, that's willing to work with you and that has your own interest in mind and not theirs, because they either have their ego at stake or their finances, and they care about that more than they care about you or your child. Believe you me. So,
no,
anyway,
man, you're totally right, beloved.
Anyways, sorry, I should have you back because I wanted to talk to you about EFT and we never got to that.
Oh, yeah, I'm sorry. Yeah, I know.
It's okay. So you want to tell people where they can find you and before we wrap it up?
Yeah. So, I do health consultations. I do EFT consultations, and I'm sure we talk about that. But essentially, EFT is it's an acupressure technique that's based upon 4,000 years of traditional Chinese medicine. It's probably the most powerful healing technique out there for curing headaches, high blood pressure, a whole host of different diseases. So I'm an EFT practitioner. I'm also a nutritionist. I specialize in giving people the real deal when it comes to nutrition. What to eat. I also teach people about natural remedies for different diseases. So I do consultations. So people can always check me out on my website. My website is drcurtisduncan.com. I'm not a doctor, just a doctor means it's just a nickname. I'm not an actual MD or ND. It's drcurtisduncan.com. It's drcurtisduncan.com.
I'm going to put it in the links too.
Yeah. Cool. And also my email address is Curtis, CURTIS, holistichealth@gmail.com. That's Curtis Holistic Health. That's HOLISTIC health HEALTH @gmail.com. Curtis Holistic Health. So you can email me there for more information. I do consultations. I'm also available for lectures, to go on speaking engagements and tours. So feel free to reach out to me. I've been doing this holistic health research now for close to about a decade. So I've done an extensive amount of research and helped a lot of people. I've even recently had a Death by Medicine conference here in Atlanta. That was probably the most well-attended holistic health conference in Atlanta in a long time. So I've been around the scene now, and I'm passionate about helping people. So and I really just I just want to try to save as many lives as I can.
All right, Curtis. I'm so glad we finally got to interview. I'm gonna put your links in the comments as well.
Thank you.
And I'm gonna have you back later in the future. I don't know how far in the future because I'm super busy, but I want to talk more about EFT, and we talked for almost 2 hours anyway. I was like, this
Wow.
can go for an hour. Yeah, I know. We'll talk forever. We're both talkers, but all right, love you, man. I'm so glad, and yeah, guys, I will talk to you later. Peace and love. Bye bye.
All right.